Good morning, good afternoon, and good evening to all of those joining, and welcome to session 2 of the This is Public Health, TIPH, Global Final Showcase webinars. My name is Holly Donaldson, and I'm the Executive Director of CAFIA, or the Council of Academic Public Health Institutions Australasia, and a member of the Global Academic Network for Academic Public Health Institutions. And I'll serve as your moderator today. Next slide, Becca. Thank you. So please feel free to submit questions to our presenters, all of our presenters, throughout the different presentations today using the Q&A button. And this will be coming up across the presentations. And we'll save all of those questions until the end, and we'll have a bit of a panel Q&A for the presenters. So This is Public Health, or TIPH, Global Grants Program is generously supported by Dr. Richard and Mrs. Linda Riegelman, and they provide awards for academic public health institutions around the world to help develop campaigns that increase the visibility of public health and promote awareness of public health issues, education, and career opportunities worldwide, with a specific emphasis on local communities, which we'll see today. So the second cohort of TIPH Global Awardees was awarded to 12 academic public health institutions from 10 countries. And this session 2 of the virtual showcase, you'll hear from 4 of the cohort 2 grantees about their projects. Please register to join us for session 3, which is taking place on June the 10th. So the 4 that we'll hear from today are the Public Health Careers Path by Monash University, Deterring On-Campus E-Cigarette use in the University of Wollongong, Shortening Diagnosis and Treatment Intervals for Breast Cancer by the National Institute of Public Health, and Building Local Capacity in Rural Guatemala and Kenya in Vanderbilt University. But first, I'll turn over now to Bethany Howard and Kirsten Marks from Monash University in Australia to begin their presentations. Thanks, Bethany and Kirsten.
Thank you, Holly. All right. Thank you so much for having us, and thank you for the funding. We're very excited to share what we've been getting up to in this last year. So our Public Health Career Paths got renamed into Public Health Insiders, which is a podcast and series of digital resources which we'll be showing you. And I'm joined by Kirsten today, who's sharing the slides. I'm going to do the second half. So if you want to move on to the next one, please, Kirsten. So why did we do this? This actually originated from some research I did early on in my career as a public health lecturer, where we had a couple of studies, one asking academics about how they felt about supporting students with their careers, particularly in generalist degrees such as public health, where you don't come out with a job title. And the academics really felt that they didn't really know how to prepare the students for jobs when they didn't really even know what those jobs were, because they can be so broad. And I did a study where I interviewed alumni of our degrees, which are health science, public health, and biomedical science. And a lot of the alumni during their time as a student felt like they really wanted to know what they could do with the degree, and they had a lack of visibility about the available career options. And so these kind of studies together made me think we really needed to do something about this. And I actually undertook a huge research project tracking our graduates. That's not what I'm here to present today, but more so how we can use that information to help address these issues of lack of visibility and career uncertainty in these degrees. So what did we do? As I mentioned earlier, we created 2 sets of resources. The first one is evidence-based, because it's based on that earlier research of where our graduates have been ending up. We're calling them public health career personas. And so they're essentially some archetypal representations of some common jobs within the field. And also we'll get to some less common ones as well, because I think there's some that are more obvious to students and some that aren't. And they're really trying to address some of the common questions that we have from students, but also people just interested in the field of public health having a bit of uncertainty about what's going on. We complemented this with podcasts, with a podcast interviewing people who are working in public health to really kind of bring those to light and provide contemporary kind of sound bites and experience. So Kirsten will speak about that a lot more, but I'm going to talk to you now or show you an example of one of our personas. So this one here, probably one of the more obvious ones, but working in health promotion as a health promotion officer. So what we've done is we use some of the funding to get these beautiful avatars made, the graphics there, and we've given them all a name, so trying to make them a little bit personal. Yeah, Kirsten, if you want to go on to the next page, please. Then we've got some alternate job titles here because in the field of public health, as in many fields these days, there are lots of different job titles. Some of them make no sense and others make more sense. So to help students think about what they can look up in terms of when they're doing job searching, we've highlighted some different names for this role. Next, please. Also talked about where they can work in this role. So the most common one being first in health promotion foundations, but also found in other aspects such as health service, government and non-governmental organisations. And we've indicated a few actual organisations that our alumni have worked at as from that research I mentioned earlier. And even sometimes working in high school. So just highlight the breadth there. So we can't list everything, but at least give them some things that they might not have been thinking about. Next, please. This next one's about how to actually study to work in this field. So what are the different degrees and pathways to that? And the final one there is acknowledging that this can actually be a registered, accredited role. There are actually a few more slides within these personas, such as knowledge and skills, but I've kept it a little bit briefer today so you can get a feel. Next one, please, Kirsten. And this is just a showcase of some of the other ones that we have and are working on too. So we've got the research one. I think health promotion and research are probably the most obvious, but we've also got policy, communications, health economy, data analysis, working as a project officer, so talking about what that is, and then also public health lecturing and education. So I'm going to hand over to Kirsten now to talk about the podcast that goes with these.
Thanks, Bethany, and good morning, everyone. Apologies for the visuals in that. I suddenly realised I'm using a compressed version of this presentation just because it was so big. So the avatars are a lot crisper and clearer than what you've potentially seen on screen just then. Anyway, moving on to the podcast. So Public Health Insiders is co-hosted by Bethany and myself. It's a series of approximately 30-minute interviews exploring the career pathways of people working in a variety of roles across the public health sector. So for season 1, we have 7 episodes, all of which are recorded. 5 are recorded, 7 are actually recorded. 2 are completed and the rest are still in editing, but we don't anticipate that will take us long to finish those. The 7 interviewees that we have had on our show so far have career experience in policy development and advocacy, leadership and governance, research, program or project management, communication and education. And we've tried to sort of keep our guests still in their sort of early to mid-career phase so that it's still it's aspirational, but also achievable to younger audiences listening to the podcast. And my presentation has just frozen. Just bear with me, please. Sorry, I'll just try that one more time. Oh, sorry. I don't know why this is just not.
Probably the video aspect, Kirsten. Maybe we need to skip past.
Yeah. Hang on a minute. I'll see if I can. Sorry, everyone. I'll just delete this slide and resave and see if that fixes it. All right. 1 second.
Rapid problem solving is often part of the public health skill requirement there too. So
It sure is. Hang on one moment. I'm nearly there. We'll try it again. I'm sorry, I'm not on slideshare mode at the moment, but it's can you see that in full screen now? Okay. So this is the array of artworking that we've come up for each of the episodes. As you can see there, so we've got the 7 people, and they are the ones that sort of go across the different career options that we had. I did have a video of one of them, which was a really lovely little clip, but I wonder if that was the thing that was causing it to stop. It was just we have videoed all of them so that we can have some social media snippets as well that are video and more engaging on social media. We did have one from Lauren Pearson that was really good, just talking about how she came to public health having gone through a nutrition degree and getting to the end of it and finding that she didn't want to just treat the problem. She wanted to stop things from happening before they even began, and eventually finding her way through to public health. And that's how she found this career as a researcher. The show notes for each of the episodes include a guest biography, definitions of public health and career concepts that are mentioned in the episode, why the interviewee is passionate about the field, career tips for listeners, and also a recommendation on an inspiring and relevant book, movie, or dare we say it, podcast to listen to. And we will widen these pages as they come out to include our personas and more relevant career information. The first 2 episodes, whilst they are online now on Spotify, that we'll officially be launching them in later June as part of a takeover that Bethany has negotiated with Croaky Media, which is an Australian health media organisation. They have a Twitter channel called We Public Health, and we'll be taking that over and drip feeding some of these episodes out in June, and in the first 2 during that week, and then weekly after that through to the end of July. And there we've got an additional list of channels that we'll be using to share the podcast. And I will leave it there. Apologies for the technical issues.
thank you, Bethany and Kirsten. That was really interesting. I can't wait to listen to those. And thank you for also persevering. We all know technical difficulties are very common where we live in a global society now. So thank you for persevering. I'm looking forward to delving into the Q&A in a little while. So next up, we have Robin Gillespie from the University of Wollongong, Australia. Over to you, Robin. And you're on mute.
I'm on mute. Sorry, I've had a few technical issues this morning getting into this meeting, so hopefully everything goes smoothly from now on. I'm going to share my screen. Hold on. Which screen am I sharing? Actually, Rebecca, would you be able to share screen for me?
Yes, just give me one moment. Let me pull it up here.
That would be helpful because I've got some screen issues this morning.
It's obviously the day for it.
It's the day.
Wonderful, thank you. Great. Okay, so we were approached by the Work Health and Safety Organisation on our campus to discuss some issues with vaping on campus. There were a lot of students who were vaping, even though we had a smoke-free and vape-free campus. So this project was born out of an internal request to do something on campus to deter e-cigarette use. Next slide. I'm coming to you today from beautiful Dharawal country. We recognise at the University of Wollongong that the lands on which we gather were never ceded. We pay our respects to elders past, present and future, and we work together to advance truth-telling, healing and reconciliation. Next slide. So a little bit of background. Vaping in Australia is definitely on the increase, especially in young people aged 18 to 24, which are the prime target of universities. University students are usually around that age. And the latest data in Australia indicates that almost 50% of young people have tried vaping at least once in their lifetime. And at the moment, vapes are still readily available through retail outlets in Australia, although the government is cracking down and putting in a raft of policies to deter the availability of vapes in our country. The University of Wollongong has restricted smoking on campus since 2016. And then added vaping into that policy. However, there's a feeling, an anecdotal feeling, that students are not aware that vaping is actually part of that policy and that vaping is not allowed on campus. Next slide. So this is just maps out the project design for our Deterring E-Cigarette project. The project aim was to deter vape use on campus. The target audience was obviously our university students, but also university staff. We have approximately 27,000 people that meet on the main campus of the University of Wollongong. That includes staff and students. The project design was a mixed method study and focused on a health promotion intervention on campus. Next slide. So we conducted some baseline survey data initially to understand what students, particularly, what their attitudes were to vape use, what their current vape use was on campus, and also what public health or health intervention messages we thought might resonate with the student group. So 10.6% of students reported vaping on campus out of that sample of 237 students. 66.1% had observed somebody vaping on campus. And actually we were surprised, 75%, or a little bit over 75% were aware that our university was a vape-free zone. But clearly the policy wasn't really working because so many people were vaping on campus. A significant number of students were current vape users, and also a significant number were interested in quitting. So this was helpful information. We felt that we were really justified in continuing on with the study. The majority of students were interested in having a vape-free community on campus. Next slide. So we then went about testing, co-designing some social media ads that we were planning to launch on the student website. We co-designed these with students. Most of the students that helped us were part of the wonderful Illawarra Public Health Society, which is a student group on campus. Then we did some qualitative testing of these messages. So the three messages we ended up testing were around the health effects of vaping, the environmental impacts, and anti-vape industry sentiment, which we found in our survey was really quite powerful amongst the student group. We had 17 participants participate in the qualitative study. And our findings were that students were very well aware of the health impacts of vaping, although they were concerned about the mental health impacts. They were definitely concerned about the environmental impacts and vape industry behaviour. So we decided to run with those three strong messages. Next slide. And here's a screenshot of the 3 messages that we're now in the process of doing some further testing on. We're a little late in this project. This was supposed to be completed, so apologies. We're doing some A/B testing on Facebook to test the effectiveness of each message and compare the effectiveness so that we understand what the reach and engagement is of each message, and we know the most powerful one to use. Next slide. So we are still going with this project. We are still running the A/B testing. Next week, the Student Club have organised an event on campus, which is building off the World Health Organization No Tobacco Day, but we've renamed it No Nicotine Day because we're aware that students are starting to use nicotine pouches and other forms of nicotine. So we're broadening that day. It's going to be a great day. We've got representatives from the local health district coming to help hand out free nicotine replacement therapies. We've got quick packs. We're going to have some wonderful posters that encourage students to consider their nicotine use. We will continue to run with this study. We will conduct a follow-up, a post-intervention survey of students late in 2nd semester, which will be late October, November for us. And we are publishing some findings. We've got a systematic review, a protocol paper, and a conference abstract in the making. So next slide. And we'd like to thank the University of Wollongong for its internal partnership and support of this project, particularly the Work Health and Safety Group, the communications team, and other organisations, Campus Pharmacy and the Medical Service. And this is one of the internal ads that are being shown on campus. Next slide. I'd like to thank everybody for their support, and I particularly like to thank my global ambassador, Emma, who's on this call. She's been an inspiration. She has endless energy, and I've just really enjoyed partnering with her and the rest of the students as part of the Illawarra Public Health Society. Thank you.
Thank you, Rosalind. That's an excellent overview of a really important health issue. We know that vaping they've been very sneaky, haven't they? The big tobacco in ensuring that tobacco is still in our society with a whole new audience. So it's excellent to see some interventions there. Look forward to seeing how you go with the A/B testing.
Thank you.
Okay. Okay, so next up we have Gabriela Torres-Meyer from the National Institute of Public Health in Mexico, and she'll be presenting on shortening diagnosis and treatment intervals for breast cancer. Over to you, Gabriela.
Okay. Do you see my screen?
Yes.
Okay.
But we need it in presentation mode, please.
Yeah.
Beautiful,
Okay.
thank you.
Well, this is a study, the name is Shortening Diagnosis and Treatment Intervals for Breast Cancer Patients, Strategy. Put yourself in my shoes. This is the group. Marisol Cabrera, who was a student before, is joining us, and she's still working with us. Breast cancer patients face several concerns, psychological, logistical, and several others. So we decided to do an intervention, patient navigation services, which is a successful strategy implemented in the United States since 1990. According to the National Health Survey in Mexico in 2022, 41% of the Mexican population has access to the IMSS, which is a health insurance system, Instituto Mexicano del Seguro Social. So we will implement the patient navigator strategy for breast cancer patients to one of the main or largest oncology hospitals, Siglo XXI, in this institution, aiming to simplify their journey from patients, minimize diagnosis, delays, and enhancement treatment compliance. The Global Health Breast Cancer Initiative has three pillars that are very important. One is to achieve diagnosis of at least 60% of invasive breast cancers as stages 1 or 2. Having the evaluation, imaging, tissue sampling, and pathology completed within 60 days, and 80% of women that undergo full courses of multimodality treatment and successfully return home. So the aim of our study is to evaluate the effectiveness of a patient navigation intervention for breast cancer patients at Mexican City Oncology Hospital. The hypothesis is that the intervention streamlines breast cancer patients' journey, reducing delays in diagnosis and treatment, and improving treatment adherence. So the methods is, this is going to be a quasi-experimental design. And I give you here an example. So like patient 1, we interview at this second phase, the diagnosis interval. So this person comes for clinical evaluation, diagnosis, and staging. So we will have the intervention, the patient navigator intervention in these two phases, the diagnosis interval and treatment interval. So these two phases will be in the intervention side. The patient interval, we will assess and record all the information for that interval, but it is not going to be intervened because this happens because before woman comes to the hospital to ask for clinical evaluation. And this is an example for patient's second patient. So we will we invite this person to be included in our study in the treatment interval. So this phase, the treatment interval, will be in the intervention side, and the diagnosis interval will be in the control side. So we will ask for the same information as for people that were in the intervention side. And for instance, this is another example. When we invite a person at the end of their treatment, when they go to checkups, this person will have the diagnosis interval and treatment interval as controls. So we will ask for the same information for those who had the intervention. So this is the quasi-experimental design, so we can assess the effectiveness of this intervention. So the data collection is conducting patient interviews with a structured questionnaire, and we also review clinical records to assess several timings and schedules. At this moment, we have 2 rounds in the Ethics and Research Committee at the National Institute of Public Health. Finally, we got their approval. And then we had to submit it to the Instituto Mexicano del Seguro Social for the same the committees, Research and Ethics Committee. And we are in the second round. And finally, the Research Committee, who are 3 reviewers, accept our new proposal. But there are still some comments from the Ethics Committee that we need to address to be able to start the study. And also and thank you very much that we got that this is Public Health Global Grant Awardee Extension Agreement to be able to continue to start our study. These are some of the main concerns of the Ethics Committee. One is to establish a workflow diagram for patient navigators and clinicians to address issues, so we will do that. They mentioned that patients completing treatment before study entry will not benefit them directly. So, we will have this information in the consent form, and we will let them know that their information could improve processes for future patients. Another issue is that they request to include a questionnaire on barriers. So we will include it for patient interval. Here are some of the aspects that we will include: diagnosis interval and treatment interval. Another issue is that how will it be ensured that intervention actions do not negatively impact the scheduling of appointments for patients who are not participating in the protocol? Well, we will only request to open up a slot when scheduling an appointment would impact established BCGI diagnosis or treatment interval. So we won't make others to be to have this problem because they are not in our study. Here are some of the references that we use, and thank you very much to all the group that is working in this project. Thank you.
Thank you, Gabriella. It just goes to show how tricky it can be, isn't it? And the timelines around projects, but incredibly important work. And look forward to seeing how you get on. A great methodology that you've presented. Thank you so much. Okay, so our next presenters are Tevin Matthew and Anjola Alua Ajayi from Vanderbilt University in the United States of America. And they're going to be talking to us about building local capacity in rural Guatemala and Kenya. Over to you, Tevin and Jola.
Perfect. Thank you so much. I think the current presentation of this current screen needs to stop sharing so I can share my screen.
Gabriella, are you able to stop screen sharing, please? Becca, maybe are you able to stop her?
Yeah, I've been trying, but I'm not able to because I'm not running this. Anthony, are you present? Would you be able to stop the participant screen share?
Yes, I'm trying, just I don't know.
Yeah, I'm looking into how to do it now, but she
Okay,
could
thank you so much.
literally just stop the screen sharing if she's unpresent.
I think I did. I stopped or.
Well, hopefully it's the rule of three. We have the three technical issues and no more for this session.
It should be in your Zoom panel.
Yeah, it says share and it's green, so I think I stopped, but let me check. No, I think I'm not sharing now because I see all the.
We can see your screen, Gabriella.
Sorry.
There we go.
Now it's gone.
Oh,
Thank you
perfect.
so much.
Thank you so much,
That's great.
Gabriella.
Perfect. Thank you all so much. Let me go ahead and set this up and make sure. Can you all see this?
Yes, we can.
Yes.
Perfect. Thank you. First, thank you to all the panelists who have presented today. And thank you to all those tuning in and joining us. As mentioned, my name is Tevin Matthew, and I'm presenting alongside my colleague, Dr. Anjola Ajayi from Vanderbilt University. And our projects are titled Building Local Capacity in Rural Guatemala and Kenya to Engage Communities, Identify Barriers, and Increase Awareness of Public Health Issues.
So we'll be following this table of contents. First, we're going to talk about the projects both in Guatemala and in Kenya. We will also talk about our study design methodology and expected deliverables. We would also give you a brief overview of our preliminary findings and our reflections and next steps going forward after conducting these studies in these local communities. For the project overview, Guatemala, in Latin America, Guatemala is known to have the highest prevalence of childhood malnutrition, and about 50% of under fives in Guatemala are said to be stunted as a result of chronic malnutrition. In Kenya, cervical cancer is known to be the leading cause of cancer in the nation, and about 1 in 10 of women I've only been screened for cervical cancer in the past 5 years. And so it's very important to engage fathers, which has been shown to improve, improve nutrition and reproductive outcomes, especially in maternal health and also in HIV research. And so that we thought to bring this community engagement involving men to see how it can help improve malnutrition in Guatemala and cervical cancer screening and vaccination in Kenya. So this map just shows our partner organization in the two countries. You can see Guatemala. In Guatemala, we worked with Primeros Pasos, which is in Quetzaltenango, and it's highlighted in red. While in Luala, in Kenya, we worked with Luala Community Alliance, which is in their primary office is in North Kamakambo, and that's where we have the Luala Community Alliance situated in. So this is just to give you a brief overview of where our partner communities are located in the world. For both our community partners, they are both involved in improving the lives of people in their community. In Primeros Pasos, they've been working currently on improving improving childhood malnutrition by employing maternal and child health initiatives to improve chronic malnutrition in the country. And their mission statement is to improve the quality of life of rural communities in the Palajuno Valley of Quetzaltenango, Guatemala, through the implementation of integrated education projects and by offering access to medical, dental, nutritional services with highly qualified personnel. While in Luala, their aim is, to build local capacity in their rural communities to advance health and well-being of the community members, and they've done this. They've expanded to neighboring counties, and has been a success in the past years.
So these are our goals for both of our respective projects. And as Anjola touched on, with the need to engage specifically with men in both of these contexts. And so first goal involves better understanding the barriers and misinformation about malnutrition and cervical cancer within Guatemala and Kenya. And then increasing awareness of barriers to male engagement, building local capacity to conduct qualitative and some quantitative research, and then utilizing this data eventually to inform their programmatic interventions. So we'll start by focusing on our project in Guatemala. Here is a photo of the team of incredible 8 women operating Primeros Pasos in Quetzaltenango. And for this project, we've been focusing on a mixed methods study. So the quantitative aspect, we're utilizing a household survey for Primeros Pasos to conduct a needs assessment. Their first and only needs assessment was implemented in 2016. And so this is an opportunity for them to now conduct their needs assessment. And then they are conducting one-on-one interviews with fathers of current pediatric patients from Primeros Pasos. And so I was able to conduct on-site engagement at Primeros Pasos in Guatemala over this past summer for 6 weeks. And so, or for 3 months, sorry. For half of that time, I was working and strategizing community partnerships with the team, and then conducting health education workshops with the mothers, as seen here in the bottom right, to build relationships with community members, in addition to learning Quiche, which is an indigenous language local to that region. And we had to receive ethical approval locally, and so I was able to work alongside a local consultant to co-create an ethics committee that was able to review and approve this study, and then Vanderbilt did the same. So some more information about our methodologies. The population of focus has the eligibility criteria of the fathers, and so over 18 years old, and this is a comparative study of Llanos de Piñal, which is the closest region to the clinic, and then Las Majadas, which is the furthest region to the clinic. And then there will be agricultural workers, and as I mentioned, fathers of pediatric patients. I'm working alongside my colleague Teresa, who is at Primeros Pasos, to recruit, so she's been doing an incredible job first contacting mothers who she works with, who then connect her to their husbands. And from there, that's where the participation occurs. And then, as I mentioned, the household survey being conducted, and then the one-on-one interviews that are recorded. And then I'm working on transcribing that data currently, translating it to English, and then analyzing it with thematic analysis.
This is the team that we worked with in Kenya, and it's a multidisciplinary team, and we engaged with the team to develop our study design. It's a cross-sectional study, and our study population was centered around men living in North Kamakambo in Rongo sub-county. We teamed up with local staff in Luala Community Alliance to build the protocol, develop the focus group research questions, and also we also worked with them to receive ethical approval and, IRB approval in Kenya, because we were not going to be allowed to, go ahead with the study without receiving approval from the state government. So our population of focus in Kenya was basically with males who have lived in North Kamagambo for at least 1 year, and they must be Luo speaking or English speaking and married with 1 or more daughters. We also engaged men who were unmarried but had active partner, or if they were unmarried but they've had a partner in the past. This is just to enable us to gather information from different sects of males that are in North Kamagambo, and our recruitment method was by convenience and snowballing sample. We also utilized community health workers network, which Luala Community Alliance has worked with and are still currently working with to engage men and also recruit participants for our focus group interviews. And these interviews we've been able to conduct 4 so far. They've been recorded and transcribed and translated into English. And we've done a rapid analysis for the sake of this presentation. And then the results, we are anticipating that we will be able to disseminate the results via community, to the community via recorded presentations and messages.
As part of our projects, as we mentioned, as one of our goals was capacity building. And so within Guatemala, when I worked alongside the consultant to create the ethics committee, another part of that was training local team. And so given the limited capacity at Primeros Pasos, I worked alongside Teresa specifically in training for the interviews. So this was an interview guide, an interview manual that I was able to create to train Teresa, and this was actually modeled after the training manual from Lawala that Anjola utilized, which she'll talk about shortly. And this is just a screenshot of me virtually working with Teresa on IRB protocols, and then eventually the interview training.
I also worked alongside with the local staff in Luala to develop a training protocol, and also we developed another training guide for the enumerators, which we trained on ethics in research. And these are just like a screenshot of the table of contents and the presentation and what we actually expected from each enumerator during the training process. And so this is just a picture of the training process for the local staff in Luala. And also this was a part of community building exercise that we proposed in our study protocol. And we were able to train at least about 6 members on focus group interview and research ethics. They were able to go ahead with the after this training, they were able to go ahead with the focus group interviews in the community.
Okay, and I know we're coming up soon, I believe, on the 10 minutes, so we'll try our best to get through the rest of these slides. This are screenshots of the interview guide I was able to create alongside colleagues at Primeros Pasos in Spanish, and both my guide and Anjola's focus group guide are framed by the social ecological model. And so questions ranging from what do you eat for breakfast, lunch, and dinner with your families, to what do you grow, what do you sell, and then perceptions of healthy versus unhealthy foods.
As my colleague Tevin mentioned, we modeled our questions to follow the socioeconomic ecologic model. For for the focus group in Kenya, we asked general questions regarding female reproductive health. We wanted to know if they discuss diseases affecting women with their spouses. This is, while engaging the men. We also wanted to know what their perception about the women's reproductive health impact in the family and in the community at large. We asked them about screening and vaccination program participation and what they thought about screening and vaccination. We also wanted to know their opinion about screening results and how they were going to react if their spouses or their partners came with screen positive or screen negative results. And we also assessed their knowledge generally about cervical cancer and if they were going to be willing to propagate the message of cervical cancer prevention.
And so now we'll briefly touch on the preliminary results that we have. So with my team in Guatemala, we've had 2 interviews conducted, one from the closer region of Llanos de Piñal and one from the furthest region of Las Majadas. And so just from brief preliminary analysis, we've been able to see a few themes between the 2. And so, for example, barriers to purchasing healthy foods, including cost as well as seasonality impacting the prices, decision-making among spouses in the households. And so we've been able to see so far, again, 2 participants, but in both of these areas, cultivation of deciding what is sold versus what is eaten at home is largely shared between the husband and the wife, whereas food purchasing and the cooking decisions are made primarily by the wife. And then perceptions of healthy versus unhealthy foods, and being able to see some areas of strength and some gaps of information that Primeros Pasos could strengthen in the future moving forward with the fathers. And this is just a photo taken by Teresa traveling to the furthest community, and you can kind of just to see the journey it takes in the trek to get to some of these areas.
In Luala, when we conducted the focus groups, we wanted to know, we had these themes that emerged, when we asked about barriers to screening and vaccination, most of the responses were centered around fear and worry of judgment from the community. Majority of the participants lacked knowledge of on the importance of vaccines, and they were false beliefs and myths that were driving, the lack of uptake to screening and vaccination. These are some of the quotes that we were able to get from the focus group, right? When we asked about the knowledge about cervical cancer, majority of them could actually relate cervical cancer to eventually causing death. But some of the causes that were highlighted include smoking, poor hygiene, use of family planning, unprotected sex, and then lack of male circumcision and poverty. They also talked about some of these symptoms, and they thought that male circumcision, good hygiene, and protection or prayers were going to help prevent cervical cancer. For the future programmatic interventions, most were willing to, encourage their female relatives and vaccination of young girls in order to prevent cervical cancer. And they also solicited for continued education and awareness campaigns in their communities to spread the knowledge of cervical cancer and improve screening uptake amongst, community members. These are some of the pictures during the focus group in discussion that was conducted last week in Kenya.
And so finally, I will quickly wrap us up here. These are our next steps since, as Angela mentioned, they're working on further data analysis. And with my team in Primeros Pasos, we are conducting more interviews. And so continuing that community engagement, data collection and analysis to highlight male perspectives, utilizing this information to inform programmatic interventions at Primeros Pasos and Lawala to engage men in their workshops, and then being intentional about data dissemination, especially in local languages, whether it's through videos or community-based media such as graphics, infographics, or community events. These are some of our lessons learned, including the importance of actively involving the community in every step of your research, from design to analysis, implementation and analysis, the importance of cultural humility, and then shared leadership when working in global contexts. These are our references. And then finally, a big thank you to TIPH, to all of our colleagues in Guatemala and Kenya, and then we included our QR codes for our LinkedIn profiles for further questions and engagement. Thank you so much.
Thank you.
Thank you, Tevin. And wow, that was an incredible showcase and really shows the power of how a little bit of global funding from TIP grants goes a long way. Particularly love how it won't just be the capacity building for this project, but also further afield. So thank you for showcasing all the wonderful you've worked in those two spaces. So now we have some time for a panel Q&A, and thanks, Becca. So the first one I might ask, I'll actually start with Bethany and Kirsten around, what do you think the biggest challenge or lesson learned is for your team when doing your project? Perhaps about what informed your decision to change the focus.
I might leave Bethany to talk about the change in focus. I think the biggest learning for me was actually practical skills rather than theoretical, which is why I'll leave Bethany to answer that. But yeah, just making a podcast in its entirety is something that neither of us has done, and was a really steep learning curve. So I think that's the big thing for me, was just all the planning and production around that. And I think that's really valuable learnings for both of us, because it's just yet another way, podcasts are yet another way that we can engage with younger people. And now that we've sort of got that, we can use that going forward as well. Bethany, if you're there, I'll let you talk more about the theory behind it all.
Yeah, I'm not quite sure what you mean by changing focus, Holly. Maybe I said something incorrectly, but this was always the intention of the grant, to do these two things. Yeah.
Yeah, fair enough. Oh, sorry, I thought because you had changed the title, I was thinking, oh, maybe there's a change.
Oh,
in
no,
focus
that
as
just
well.
became, sorry, that just became the name of the podcast. So that's
Got it. Okay,
okay. We
great.
didn't
Yeah.
have that when we applied for the grant. It's probably the thing that took the longest to come
Yeah,
up
I was
with
gonna say,
it.
that was probably the biggest component of it, wasn't it? Just deciding on a name.
Yeah, fair enough. That's true. Look, branding is important, as we all know. Words matter in public health. I actually have a related question for that, which is, given that we know globally that with the World Health Organization doing a whole piece of work around who is the public health workforce and the core and then the others who support the various public health work, do you think that these could be applicable to those outside of Australasia as well?
Yeah, absolutely. We've definitely designed them with Australia in mind, probably even more specifically Victoria. So we plan to kind of make on our website that if anyone wants to redesign these for their context, that they can. So putting organisations that are relevant or adding in different role titles to create more global flexibility. There is certain things that are, I think, area location specific, but not as many as we'd like to think.
Yeah, fair enough. Okay, great. Thank you for sharing that. Okay, I might ask the next question of the fabulous Wollongong team. So Robin, could you tell me what methods you found as the most effective in reaching your audiences and building momentum?
Yeah, sure. Thanks, Holly. Good question. I think we're hoping that the social media platforms will be the most effective, because we know young people are definitely on social media. Although we're yet to really run that, because we had some we had some partnership issues with that. We were hoping to be able to run our social media campaign on the internal UOW students Facebook page, but that was decommissioned at the beginning of the year. And then we struggled to find another platform within the university that was willing to partner with us, because we wanted to do the A/B testing, and they were concerned about us accessing data, even though the A/B testing only accesses publicly available data. So there was a lot of challenges of working with partners to convince them. So looking at the systematic review that we've done of other health promotion programs that have used social media, we know that Facebook, Instagram, and TikTok are the most visited platforms by young people. That reach and engagement on those platforms is quite high with health promotion programs. So we're hoping that the same will be, we will have the same engagement with our content. We're expecting that the highest engagement will be with the anti-vape industry sentiment, because that was in the survey, that was the message that most resonated with students. We're expecting that we'll end up seeing the most reach and engagement with that message. Does that answer the question?
Yeah, absolutely. So one of the things we have here, of course, is that we learn from each other, and that this is part of a global public health community. And I have to say, I thought, oh, I wonder if, podcasts delving into those aspects of the industry sentiments would help bring awareness and perhaps give further incentives. So in terms of lessons learned from other
Yes.
platforms.
Yes, that is something to build on.
Yeah, exactly.
Yeah, no,
all right, great. Thank you so much for sharing with us. Okay, so Gabriella, I have a question for you. So clearly you had some real challenges, so this is very normal in this sort of space around ethics approval and to move the project forward, and it's great that you're able to have an extension. But I'm curious about given through that process of going back with the ethics and having that feedback, what were the lessons learned you had through going through the ethics, and what would you do differently next time, perhaps?
I think every time that reviewers give more insight to the project, of course, it's going to be better. So at the beginning, we were just going to start the navigation intervention without really evaluating. We were just going to compare with the timelines that are directed by the Breast Cancer Global Initiative, but they wanted a design. So then that's why we started with the quasi-experimental design, because we cannot do like an intervention that having some intervene and some with intervention and some without the intervention, because we know that this navigator has been successful in many other countries. So in fact, I was in last week in a presentation from Chile, and they have a lot of these navigators, and it's working very well in their cancer plan. So what I learned is that maybe we should start always with the best design, even though it's already measured in other countries, because they will always say, well, and if this doesn't work in our community, why we have to spend on these persons or these navigators. So I think that's what I have learned. And of course is I have worked with many projects in my life, and to get into this Instituto Mexicano del Seguro Social is one of the most difficult, because when you come from another institution, it's kind of difficult to get into another with other people. And even though one of them is part of our project, it's not so easy. So yeah, maybe to engage people more people before submitting the project, that would be another lesson learned. So
yeah, that's it. And it's so true, isn't it? You don't realize the sort of, if you like, the politics or the kind of the pre-decisions you need before getting everyone on board for things. Thank you so much. Well, I really hope you are able to go forward and demonstrate effectiveness in this. Thanks for sharing.
Thank you.
So my next question is for Tevin and Jola. So you had an incredible, you did incredible work in both of those countries. And so I was wondering if you're able to share with us if you had any clear moments of success or breakthroughs that you'd like to share with us.
Kevin, do you want me to go first?
Yes.
Okay. So I think for me, it was being able to have something to actually present at the end of the year. I mean, yeah, today actually, because as at I think a month ago, we had not gotten IRB approval still. There was a lot of back and forth, and it just wasn't coming. But after getting the approval and then the ethical approval afterwards, everything just went like really fast in the space of 1 week. And we had a lot of cooperation from the local organization we were working with, but it just looks like it wasn't coming. And we had, created the timeline based on what we felt was going to work. But it made me understand that you have to actually engage the community you're working with and understand their own organizational framework and how things actually work back there. Because I was thinking IRB approval was going to be very fast. If there was going to be any correction, they send it back to us and then we, revert back to them and get our approval to go ahead with the study. But it just wasn't happening. And it was frustrating. And I think that was the lowest point for me. But the highest point was a week ago, 2 weeks, when everything looked like there was a green light and we were going to make it. And yeah, I'm really happy about that.
Oh, wonderful. That's so classic, isn't it? That hearts and minds, you might get the tick, but it's about have you got the real tacit, yes, we're going to do this. Oh, wonderful.
Yeah.
And Tevin, did you want to share too?
Yes, similar to Anjola, but several months ago was also the journey to get the local ethical approval, and especially being on site with Primeros Pasos and trying to figure out who to contact across the country. And but the team was so supportive and connecting me to the consultant, and from there it just flowed pretty well. But it was definitely a journey to get to that point. So getting that approval was a huge step. And then even just getting that first interview with a participant and having my colleague Teresa just working so hard, even on off days from the clinic to do this work. And so, but there's been a lot of interest from the fathers in these communities to participate. And so that's been really rewarding, as well as to see just interest from the community.
Oh, brilliant. Yeah. I mean, men as allies in women's and children's health is just so, so important. So thank you for sharing your work. So Becca, could we do I don't know if we need to bring the thank you slide up, but I wanted to say a big, big thank you to all of our wonderful presenters today. It was incredible to hear how you've gone with the TIPH Global Grants program, and also how you've hopefully learned from each other through the process over the year or so. So thank you for joining us today, and congratulations to all the grantees for the really impressive work this year. So we hope to see you on June 10, if you please register if you haven't already. And yeah, best of luck, everyone. So I'll say good day, good evening, good night to everyone, and see you shortly. Bye for now.